To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today we are going to talk about chronic pain. To help us through it is Dr. Pam from Valley Acupuncture and Wellness. Hi, doctor.
Hi, how you doing?
Good. You know, we hear a lot of things about chronic pain, but I wonder, when do we know it's chronic pain? Is there a length of time that we need to be suffering from something to qualify?
You know, chronic pain, there's acute pain, so you fall and you sprain your ankle. That's acute, right? Typically, anything over, 3 to 6 months, we would say is more chronic. Typically, 6 months is.
If it's not something that you can directly, okay, I fell and this hurts, and it's got, okay. That's good to know. And then in your practice, you're treating a lot of people with these kind of conditions. What types of pain are people coming in with?
If all over body pain, so things like fibromyalgia, something that we don't hear too much about, Ehlers-Danlos syndrome or EDS, that's a really common diagnosis that actually gets missed quite a bit, connective tissue disorder that causes pain throughout their lifetime.
If you have EDS, what does that look like for somebody who's dealing with it? Where are they not feeling great?
It's a hypermobility issue sometimes in joints. It can be a connective tissue disorder, but they can have pain that mimics even fibromyalgia, just pain in a lot of different places. And
while we're on the topic of pain, let's get into how you're helping people get out of pain.
Sure.
What's the number one go-to for you?
It depends on the person. Everybody's a little bit different. Acupuncture, I think, is a really powerful thing. It works really well for some conditions. Some other things that we do a low-level current, frequency-specific microcurrent, and that's something that, when we see people with things like EDS or fibromyalgia, it typically works really well with.
Is there a length of time when you're going through these treatments that usually it starts to make people feel better?
People, a lot of times they'll notice something after the first or second treatment. They'll notice that maybe they slept better, It can take 10, 12 treatments before they really start noticing, especially those really chronic conditions, because the brain's just wired to notice the pain.
Yeah, and after we've gone through those treatments, how are people feeling after that?
Looser, they can sleep better. We really try to, reduce that inflammation so they do feel better and they can function better in life.
Yeah, you'll notice it right away.
Yeah.
Well, Dr. Pam, Valley Acupuncture and Wellness, thank you so much for walking us through chronic pain, and we want to thank you for watching To Your Health.
Thanks.
The preceding was a paid advertisement.